Welcome to the Power of One. I am so excited that I get to have Dr. Serge Simpson back with me. We spoke about opioids before, and that cannot be a one and done conversation because we need to know more. So welcome back to the show, Dr. Serge.
Thank you, Melany.
So let's start out with a little refresher. What does opioids do to the body?
Well, that's a great question, and it's one of those things that the more you study it, the more complicated it gets. I think, sort of on the surface, they're primarily used as pain medications, and the way they do that is by essentially interrupting the communication between the site that's in pain and your spinal cord and brain. By just quieting the nerves that typically carry that signal. I think that's one way to put it.
So if there's someone who is addicted to opioids, now we're going to switch to the street side, if you will. We're not speaking about someone who has been prescribed opioids. So if there is someone who is using opioids on the streets and they get hurt, and they have to be hospitalized, they're not going to be able to consume opioids anymore. Is that when you come into play? If we have someone who has to be admitted for a long period of time and they're on opioids, their body will start to feel some withdrawal symptoms?
Yeah. Let me take a step back real quick, because I think a different way to answer your first question will sort of help answer the second. So when I said that opioids are a great sort of pain medication, what's interesting about them is that they don't seem to just treat a physical pain. They seem to do a really good job, at least temporarily, treating emotional pain and making people strangely feel energetic, feel very capable. It makes people feel good, I think, is what makes them so seductive. So not only does it help with pain, but it just helps people feel good. And so people can get addicted to that. You can see why that would happen, right? It's not just a simple matter of making pain go away. And so, like all medications that work in the brain, if you use them for long periods of time, daily, your brain adapts. And so when you abruptly stop taking those medications, you can get a withdrawal syndrome, which basically is your body missing what it's gotten used to, right? And that can be real severe, or it can be subtle. In the case of opioids, it's pretty severe. And so that's where I try to help in my hospital. I try to find ways to ease the suffering of withdrawal through a number of means, not just by giving opioids back.
What will some of those symptoms look like?
Oh, great question. Yeah, in the beginning, it can be pretty subtle. It can be irritability, anxiety. It tends to sort of progress from there to pain, right? The sort of the very same mechanism by which the opioids dull pain can sort of become unbalanced, like a seesaw, and swing back, and then people can feel pain all over the place, or in a site that's already hurting them, right? So pain comes next usually. And as things progress over hours to maybe even a day or so, then you start to get some obvious physical signs, I'll say. So, a physician or even a person who's used to seeing this will recognize some of the later signs of withdrawal as, sniffling, yawning. Sometimes people's limbs sort of move involuntarily. That's where kicking the habit sort of comes from as a phrase. And then usually later on, when a person's pretty seriously in withdrawal, then they have a lot of pronounced gastrointestinal effects. They'll be vomiting, having diarrhea. That's how progression.
I'm sorry, Doc. Go ahead. I didn't mean to cut you off.
No, I think that would be the progression. People might disagree that some things are more prominent than others for them, but that's kind of a generalization.
How long can those symptoms last? Is it like 2, 3, 4 days a week, or does it vary person to person?
Yeah, I would say it varies person to person. Even withdrawal is not straightforward, but typically, I think it's fair to say that at least the people I'm seeing will go through their well, let's say about 2 or 3 days where you'll start to see things go from mild to really severe. Patients who, for example, are withdrawing from a long-acting opioid like methadone, their withdrawal can get just as severe in that short amount of time, but will just last a good deal longer. Um, and it depends on how long the person's been using opioids. Their feeling unpleasant could go on for weeks. So it's quite variable.
Can someone pass away from withdrawal of
That's
opioids?
that's a great question. So in medical school, back when I was in medical school, in the late '90s, we were taught that like opioid withdrawal is not lethal. So
Mm.
relax and tell your patients to relax. And that's, I think, missing the point. What I've learned over the years is that patients fear withdrawal profoundly. It is, and whether it's lethal or not, I don't think makes a difference. They are petrified of going through that experience and will do almost anything, if not anything, to avoid going through it if they know what it feels like. So, it's not directly lethal the same way that, say, alcohol withdrawal has been shown to be over the years, but it is so painful for people and so unpleasant that I think the distinction is a pointless one.
The withdrawal period, is the drug totally out of their system? You know what I'm saying? So, and I don't know how to ask this question on an educated level. So how long does it take for opioids to pass through your system to totally be out? And is that withdrawal occurring because it's totally out of their system?
That's a very good question too. So there's a lot of different opioids. I think we covered that in the first conversation we had, that there's, just because a chemical interacts with your opioid receptor system, it is called an opioid. But some opioids linger in the body for weeks to months, like the case of buprenorphine, what's in Suboxone or methadone. Those can be detected in people's urine depending on how much they've had over time for over a month. But then there's shorter acting ones that are cleared much faster, like heroin, for example. So, but what we found, I think as a medical community, is that the duration of the withdrawal symptoms doesn't seem to correlate just with, how long the opioid lingers in your bloodstream or your urine. So they're uncoupled, they're unrelated. I think what drives the withdrawal is the changes that have occurred in the brain, and how long it takes the brain to get normal. May be related to lingering opioids in the system, but I haven't seen that to be the case in my experience. I think they're independent things.
So when I asked the question, and I don't know if you can answer this, and it blows my mind. So just speaking on opioids as a whole, how some people actually pass away using opioids, which would be frightening to me. And my oldest brother, who had an experience, had many years of using, but he wasn't using opioids. And he was addicted to cocaine, crack cocaine. And I would ask him all the time, like, you wasn't, like, when you would go get high, you wasn't scared? He's like, Mel, come on now, I'm getting high. I'm not scared of dying. Like, okay, so that would be my biggest fear.
Yeah.
How is it that opioids cause death? Is it something with the chemicals in your body one day, and it just, how does that occur? I don't know if you can answer that question.
Yeah, sure. So like the most direct way they can cause death, and the sort of way that they're, I guess, most famous for, would be to make you so sedated and unconscious that you essentially stop breathing. So opioids are maybe uniquely powerful in this effect, that they sort of desensitize your brain to falling oxygen levels in your body and rising carbon dioxide levels in your body. So when we breathe, we exhale a carbon dioxide, and we inhale oxygen. And both those functions are necessary for survival for different reasons. And the lungs sort of like, do both jobs. When you slow your breathing down and take shallower and shallower breaths, your oxygen drops, carbon dioxide goes up, and you essentially quietly suffocate. And that's how people typically die of overdose from opioids.
Mhm.
And certain other drugs will like make that worse, will accelerate that. So benzodiazepines in particular are notorious for really making that a far more likely prospect when you use opioids. So combining those two is extremely dangerous.
Mm. Now, when someone's clean and it's out of their system, however long it takes, do you know, and this is, I guess, a statistic question, if a lot of people go back and use again, and if they have a long period of time where they didn't use and then they use that opioid again, can it affect their body differently?
Oh, for sure. No, that's a great question. Um, so let me see if I get the question. If I understand what you're saying. Like, so if when a person stops using opioids and then like they go through their withdrawal and they
Mhm.
get through it, right, and they're sort of
Yes.
back to normal, um, then yeah, they are just as sensitive to opioids as a person who's sort of never used them is, and they will be as likely to overdose if they use a really strong one. And so this is really dangerous. In fact, we used to see this with people who were jailed and went through withdrawal in jail. Back before we were sensitive to this, and we would just let people detox in jail without any treatment, and then let them out without any support. Those people were at extremely high risk of overdosing and dying right after coming out of jail because they would still want to use, the sort of changes to the brain that make a person triggered and interested in using opioids, that persists for a long, long time. But
Mm.
their physical tolerance to that sedating effect and that respiratory depression effect goes away relatively quickly. So they might go out and use what they're used to using, try to get high and die. And so that's true for anybody who relapses or goes back to using for whatever reason. And that's especially a problem in this today when the average bag of dope has fentanyl in it and large amounts of fentanyl in it. It's relatively unforgiving for novices and people who are not used to it, and in a way that I think the dope supply has never been. It's extremely lethal to people who are not used to it.
And so with the overdose, like when you're using these drugs, you don't know what your body limit is, and that's, you know what I'm saying, what
Right.
causes the overdose. Like if you feel high, do you know you're getting higher than and higher and higher, or they're thinking that they're taking the amount that their body can handle?
Sure. Yeah. So do people just essentially like quietly pass away when they overdose? Is that essentially what
Yes.
you're asking, or do they? Yeah. I
Yes.
mean, like,
Uh-huh. Yes.
typically that is the case, which makes it so dangerous. And if people use alone, out of shame or because it's illegal or they're hiding something, especially if they've relapsed and they don't want people to know, so dangerous because people won't check on them and they won't be able to save themselves by and large. I've seen exceptions to that, but like for the most part, yeah, you'll quietly slip away, um,
Mm.
which is really a shame and
It
sad.
is. It really is a shame. Now, for those who are prescribed opioids, and I know this is not your area of expertise, but opioids is your area of expertise. You're amazing. So, for those who are prescribed opioids, when they need to get off, their doctor has to actually wean them off. And is that called drug tapering? And would they prescribe another drug for them? Or even if someone comes into the hospital and you know that they're on opioids and they have to get off, do you prescribe another drug to supplement what the opioids were?
Yeah, so yes, you're correct. So that's drug tapering. So when you slowly bring the dose down, that's a age-old sort of technique for getting people as gently off opioids as possible. If you abruptly stop their opioids, as you can imagine, it's like really unpleasant on that time scale that I mentioned earlier. Tapering is an art, and it requires, I think, a lot of patience on your part and coaching for your patient's part, on your patient's part. Sorry, coaching for the doctor to do for the patient because it's unpleasant. It can start that anxiety that I mentioned sort of in early withdrawal because that's the process that you're inviting by tapering a person down. And so whether or not there are medications that can sort of help with that, like sleeplessness, you can give medications to combat that. The aches, you can give medication to combat that. The untreated pain, you can try non-opioids to combat that. And you should, as a physician, really work carefully with your patients and encourage them. I think it's not something that any patient will tolerate if they're forced to do it because it's unpleasant. I think you really need buy-in from your patient and to convince them that it's for their own good, if indeed it is. Their withdrawal is something that I think that I certainly didn't understand very well coming through medical school. This is again in the 90s, and I'm hoping that we train physicians better. I've learned a lot on the job, and there's a lot in the medical literature that sort of has guided me in my independent reading. So I do find that some medications extremely helpful, like clonidine. It's an age-old medication that sort of reduces some of the symptoms of withdrawal. So I rely heavily on that in the hospital and outside the hospital when I'm trying to get people down, their tolerance down. Does that answer your question?
About addiction. Like, how would one know they're addicted to opioids? Is it like, and so crack cocaine, you kind of knew, like you could spot somebody and you could see, oh my goodness. And of course, the term they used was, that's a crackhead. You know what I mean? You can actually go down Kensington and you can see people who's like in a stupor, but there's different types of opioids. How does one know they're addicted to drugs? Even somebody who's probably prescribed opioids, how do you know when you're addicted?
Right.
Or your body needs it. That's what I'm going to say. Your body actually needs this drug every day.
So those are essentially two different things we think of as physicians. We classify those in two different ways. So there's like dependence, which is your body needs it, right? If you take it away, you're going to have a withdrawal syndrome. That's essentially the cornerstone of dependence. Now, like an addiction we don't use anymore, we try to get more specific and we'll call it a use disorder. I don't know if you've heard that term. It's like an opioid use disorder taking over, or a cocaine use disorder taking over the original language of cocaine addiction or opioid addiction. And that's very specific because it says that like, yeah, okay, you might be tolerant, you might use it every day, but among people who use it every day and need it every day, there are folks who are able to hold down a job, attend to their family's needs, don't get injured using that medication, don't injure others, right? They've got their stuff together. So that person doesn't have like a disorder. They just have a physical need to remain on that drug. I think a good example is people who drink coffee every morning, right? If they stop, they get a bad headache and they feel unpleasant, so they have to drink that cup of coffee to keep that at bay. That's dependence. But otherwise very productive in their lives, it's not a use disorder, right? So I think that's the distinction. When you notice a person is failing at, doing the things they need to succeed in their own life and to sort of, be a good, father, mother, husband, wife, son, daughter, etc., to their families, things are starting to fall apart. And I can be more specific. There's, criteria that psychiatrists use to sort of assemble a score, but they hinge on these things. Like, what is a person giving up for their drug use, damaging their life? That's when you cross over into a use disorder. And psychiatrists have their checklists, but family members can just tell, right? They can tell when their loved one is really struggling under the weight of their drug use. And I think that's kind of the broadest stroke, to sort of paint there that, this person's having a use disorder. Things are falling apart for them.
Is opioid use, or we'll go back to crack cocaine. So crack cocaine, they say when you use that for the first time, you're hooked. Is that the same thing with opioids? If someone uses an opioid for the first time, that they're hooked?
No, I think that's an exaggeration on both sides. I think they're very seductive drugs. They're very efficient at hijacking sort of the way our brains work. And so, in the case of both cocaine and opioids, they have a great track record for hooking people easily. I'm not, but I won't go so far as to say if you use it once, you're doomed, you're hooked. But there is something in the middle there that like these are extremely habit forming substances. They hit you in a place that makes you feel really good, in a way that sometimes you can't even put words to. And for people who chronically don't feel good for whatever reason, um, it's extremely seductive. So you know, I'll say that people who are inclined to addiction for whatever reason, and those people do exist. They they really should stay away from drugs like that, and physicians should be very careful to not introduce patients who don't need opioids to opioids for minor injuries, knowing that there's a, and I think I explained this last time I talked to you. The CDC released some data in 2017 that showed that there was like a linear rise in your chance of continuing to use opioids after having received one prescription. Like the longer that first prescription of opioids were, you had a sort of a linearly increasing chance of still being on those opioids a year later, presumably because you're addicted. So like every day that I have you on an opioid, I increase your chance of getting hooked on them as a physician. So I think that kind of answers your question too. Yeah, they're dangerous medications to get involved with because you may not be able to succeed in getting off them.
So this reminds me of what came first, the chicken or the egg. So my thought is, what came first, the pharmaceutical company or the drug dealer? How did this happen? You know what I'm saying? So was it the pharmaceutical companies that created this drug? And that's dangerous. Make no mistake about it. And it may serve some good. And they charge a lot of money for these drugs. That's a whole nother conversation. And then is it that someone who was getting high with this drug and said, okay, this makes me feel good, I could sell this on the street? Like, how did this come about, Dr. Serge? Tell me, people are just so crafty. So tell me how does this happen?
That is interesting. I don't know enough to succinctly answer that question. I know that opioids in one form or another have been in use by people for pain control or to feel good. I couldn't tell you, for thousands of years, well over 3,000 years. Okay, so what was going on back then? Like, were the opioids strictly controlled by medical, trained ancient physicians? For lack of a better word, I couldn't tell you. I think things certainly got real out of hand in the late 90s when the Institute of Medicine was sort of responding to, I guess, some real concerns among patients that pain wasn't being treated adequately by physicians across the board, and in particular, minorities tended to get even less pain control. There's of course the slavery era false conception that Black people don't feel pain. That whole craziness sort of, I think, leaked into the sort of modern era, and that was those health disparities were are fact. Like physicians were mistreating Black patients and not treating their pain adequately. So there's that sort of historical backdrop, and then of course there's people like the Sackler family and other folks who have profited off of the sale of opioids, who knowingly minimize the risks of using opioids, like culturally well-known risks. They actively pushed against them and introduced a false sort of medical narrative that they don't cause addiction, which we now, we knew then, and we now were reminded that it's not true. So they profited tremendously off of the sale of opioids like oxycodone in the beginning of the 2000s. So like, it's both, like I think opioids, lend themselves to medicinal uses very well. And that very same sort of power is harnessed by people who are trying to make a dollar and operating outside of the medical community, and so I couldn't tell you chicken and the egg. It's just the same quantity, right? Yeah, the kids are pretty.
Yeah, people are crafty. But I want to thank you so much for breaking everything down. And as always, you have been awesome. Thank you so much, Dr. Serge.
It's my pleasure, Melanie. And yeah, hopefully I've answered your questions adequately. Have a good
You
day.
did. You sure did.
Okay.
Thank you so much for joining us today. We spoke about a very serious topic. So understand, people who use opioids cannot just stop cold turkey, because it will hurt them in one way or another. And we are so blessed to have doctors like Dr. Serge, who will take care of all of those patients who, for some reason or another, have to detox. Thank you so much for joining us today.